Natural Family Planning. Introduction. Linda, a sexually active woman, had her regular period at the end of the month. Is she likely to be pregnant? Select yes or no. Correct. A regular period means that she is not pregnant. Natural family planning is often not as effective in controlling pregnancy because which of the following? Choose one of the following options. 1. Sperm can live for up to 5 days in the female reproductive system. 2. The day of ovulation and the length of the menstrual cycle may vary from month to month. 3. All of the above. Correct. The basal body temperature method requires taking your temperature orally the moment you wake up each morning for a few months. Select true or false. Correct. Ovulation may cause a rise of 0.5 to 1 degrees in a woman's body. However, some women do not experience this rise in temperature when they ovulate. Other factors may also interfere with this method. The following is a chart of Emily's basal body temperature during her last menstrual cycle. Please point to the day when she can start having sex if she were to follow the recommendations explained in the basal body temperature method of natural birth control. Choose one of the following options. 1. Day 6. 2. Day 11. 3. Day 14. 4. Day 18. Correct. This is more than 3 days after ovulation. The chances of getting pregnant are significantly reduced from this time until the end of the menstrual cycle. A woman is most fertile when her cervical mucus is white or yellow with a sticky feel. Select true or false. Correct. The statement is false. A woman is most fertile when her cervical mucus is clear and slippery. Rachel follows the cervical mucus method. When can she have sex based on the birth control instructions of this method? Choose one of the following options. 1. Days 1 through 3 and days 17 through 28 when her mucus is dry or dark and thick. 2. Days 13 through 16 when her mucus is clear and slippery. 3. Only days 17 through 28 when her mucus is dark and thick. Correct. Which one of the following symptoms suggests that ovulation is taking place? Choose one of the following options. 1. Abdominal cramps or pain. 2. Changes in the firmness or position of the cervix. 3. Spotting. 4. All of the above. Correct. These are additional signs of ovulation. However, not all women will experience these signs when they ovulate. May uses the calendar method for natural birth control. She has marked the first day and last days of her fertile phase with an X on her calendar. It is relatively safe for her to have sex only on the days between the two X marks if she does not want to get pregnant. Select true or false. Correct. She should avoid sex in the days marked with an X on her calendar and all the days in between if she does not want to get pregnant. This is when she is most fertile. A change in the hormones caused by breastfeeding can prevent pregnancy. Select true or false. Correct. Breastfeeding causes a change in a woman's hormones that prevents the menstrual period and ovulation. This can help prevent pregnancy up to 6 months after giving birth if feedings are not too far apart.
Thank you for using Explain.